This test is the Y balance test, and it can be used for the lower body or for the upper body. In this test, it is a single limb, multi-directional, closed chain excursion test. With the Y balance test, they are going to move the slider in each direction, either with their hand or their foot, as far as they can go without losing their balance and returning to that starting position. What we are doing with this test is we are seeing limb symmetry between each leg or each arm. We want no more than a 4 centimeter difference between the two, and you can also normalize this to their height by getting a composite score where you measure their limb length, add up all 3 motions, and then divide that score by their limb length to get it referenced to themselves. So the Y balance test, it is a great test for single leg control and stability with reference and demands in a multiplanar fashion. But the one downfall to it is that we are not externally loading. So we need to make sure that we are utilizing some of our other strength metrics to get a more complete movement profile of this individual. For the lower body, when they are pressing out with the slider, the stationary leg or the stance leg needs to stay flat on the ground. The heel cannot come up and the toe needs to stay behind that red line. With that, they also need to press the slider out, pushing from the back of the slider instead of having their foot resting on top of the slider. After they press it out, they need to return to a balanced and controlled point for that individual to count that repetition. With this, things that we're looking for is not only the extent that they can move, but also the quality or the manner in which they are doing so. Because there are so many moving pieces and it's a relatively complex test, we also need to be mindful of other influential factors from a balance or a proprioceptive standpoint, or more importantly, just the novelty of the task, if they have ever done anything like this before, that may influence the execution of this test.